Swelling in the legs after vein harvesting for heart bypass surgery is one of the most common and most misunderstood parts of recovery, and it often causes unnecessary fear in patients and their families. So let me explain this clearly and calmly. When a vein, usually the saphenous vein, is removed from the leg to create bypass grafts for the heart, the body experiences a combination of surgical trauma, temporary disruption of normal blood flow, lymphatic vessel disturbance, and inflammatory healing response, all of which naturally lead to fluid accumulation in the leg tissues known as edema, and in the first 1 to 2 weeks after surgery. This swelling is expected to be most noticeable, especially around the ankle, calf, and sometimes the thigh, and it often becomes more obvious toward the evening because gravity pulls fluid downward when you sit or stand during the day. While in the early recovery phase, your muscles are weaker, your mobility is limited, and the normal muscle pump that pushes blood and fluid back to the heart is not yet fully active, which further contributes to swelling, and this early swelling is usually soft, painless or mildly uncomfortable, improves with leg elevation, and reduces overnight while sleeping, which are reassuring signs of normal healing. Between weeks 3 to 6, most patients notice a gradual reduction in swelling as walking increases, circulation improves, lymphatic channels adapt, and inflammation settles, although mild. Residual swelling may persist for several weeks or even a few months, especially in elderly patients, diabetics, or those with varicose veins or pre-existing circulation issues. And this prolonged but slowly improving swelling is still considered normal as long as there is no redness, increasing pain, fever, discharge, or sudden worsening. However, it is extremely important to understand when leg swelling is no longer normal, because warning signs require immediate medical attention. If swelling suddenly increases instead of improving, becomes tense and painful, is associated with redness, warmth, or skin hardening, or is accompanied by fever or pus-like discharge from the wound, it may indicate infection. While sudden swelling of one leg with pain, tightness, or skin color change may suggest a blood clot, which is a medical emergency, and similarly, swelling in both legs along with breathlessness, rapid weight gain, or fatigue could signal fluid overload or heart failure and should never be ignored. To support normal recovery and reduce swelling safely, patients should elevate the operated leg above heart level several times a day, avoid prolonged sitting or standing, walk frequently in short intervals, wear compression stockings if advised by their doctor, maintain adequate hydration, limit excess salt intake, keep the wound clean and dry, and follow physiotherapy and medication instructions strictly, while remembering that every patient heals at a different pace and comparing your recovery to others often leads to unnecessary anxiety. Most importantly, leg swelling after vein harvesting is not a failure of surgery. It is a sign that the body is healing and adapting, and with patience, movement, and proper care, it steadily improves. But the key to safe recovery is awareness. Knowing what is normal, recognizing red flags early, and staying in regular contact with your healthcare team. Because timely reassurance prevents fear, and timely action prevents complications.